Yeah, I think a couple things that I would add to that. So one is I think lubricants are very underutilized, particularly in the postmenopausal population. Everyone, every single woman who goes through menopause is going to have what we call atrophy or thinning of the vaginal lining, which causes which can be the entire cause of your pain. So using a lubricant, it can be as easy as going to your kitchen and getting some coconut oil or olive oil. I mean, you don't have to go to the store even, and it really works. So a lot of people just don't use anything, and it's not, once you're postmenopausal, and even if you're premenopausal, lube can be used to enhance your sexual experience and make it more comfortable. So I think that's one really big part of sexual dysfunction in couples, is that you're trying to do something with friction, and it's painful if it's dry, right? So using some lubricant can go a long way, and I think that that's really important. And then the other thing you mentioned, desire, and I think we think of sex as this very reactive desire, right? Like you see your partner, you get excited, you want to have intercourse with them, but that's not what happens when you're older. The reactive desire kind of goes away, but that doesn't mean that you can't create desire by just being with each other, holding each other, being physically close to each other, and then building the desire that way. And so that's one thing that I recommend. And then Dr. Davenport mentioned this earlier, and I also recommend it, is actually scheduling intercourse. One, because it takes the pressure off of like, oh, my partner's going to initiate and I'm not in the mood, right? I don't feel like it right now. And then you're letting the partner down and you're feeling bad about it and whatever. So one, that, and two, if you think about when we used to have intercourse as younger people, you'd be going on a date, right? And you'd be excited for that date. And you knew that there was going to be some, intimate time during that date. And so you got excited about it. And you had time to think about it and get excited. So it's the same thing. If you have a scheduled time on the calendar, you can get time to get excited about it. So those are my tips.